Now, on the possible health benefits of aspirin, and we know you've heard a lot about this back and forth about aspirin, right? But there's a new study out that's suggesting aspirin can greatly reduce the risk for serious liver disease like cancer. Joining us now from Johns Hopkins University, Dr. Marty Makary. He's the author of Unaccountable, What Hospitals Won't Tell You, and How Transparency Can Revolutionize Healthcare, which sounds all the more. We're going to have to talk to you about that book someday, Dr. Makary. But we're going to talk about this study first. This is a big one. This is from the National Cancer Institute. 300,000 people were in this study. What exactly is it telling us about aspirin, and why would aspirin be effective in liver disease or liver cancer?
Well, Jenna, it's showing another benefit of aspirin. You know, aspirin has already been put out there to benefit patients by preventing colon cancer, and many have found it to even prevent breast cancer in some studies. This adds a third major cancer to the list. It's liver cancer. The study was not perfect, but it does show dramatic reductions of up to 47%. So it is something to think about now, and aspirin may be something to really consider.
It's sort of interesting, though, right, when you think about taking medication and giving your liver something extra to process. What about the risk, doctor, to just taking aspirin for a long time, 10, 20, 30 years? Is there something to consider there?
Well, in general, aspirin is recommended for people at risk for developing certain cancers. So for normal, healthy, everyday people, we no longer recommend aspirin because of that risk of GI bleeding. People can get ulcers and other GI problems. So aspirin probably works by reducing body inflammation. A lot of the dietary stuff we eat nowadays probably cause generalized inflammation, and that inflammation is what may be leading to some of these forms of cancer.
You know, that's interesting because we heard about inflammation when those studies on sugar came out, and inflammation in the body caused by sugar, and maybe that being linked to cancer. So we'll continue to watch that. Real quick, doctor, for all of us that are out there listening to this, what should we ask our doctor before giving ourselves aspirin? Is there one or two questions we should ask?
Well, the most important question is, are there things in the diet to change to decrease generalized inflammation, like eating more balanced omega-3 and omega-6 balanced fatty acids, less sugar, things like that? Second of all, if I have a lot of inflammation, can I take aspirin, and will it be safe in my GI tract?
Do you take aspirin every day? I'm just curious.
I don't, but I do plan on starting to take it once I turn 50.
Okay, that's interesting. Sometimes it's good to know what doctors really think about this. We have to get your take on this new study, doctor, as well. Another one, it's been on the web all week, and I'm sure some of our viewers have seen it. And it's a new study that suggests that chemicals that are being used to treat furniture, like couches, are making people sick, and those chemicals are flame retardant chemicals that in some cases the government requires furniture makers to use because of certain regulations. Just surface level, what do you think about this study? How concerned should we be?
Yeah, this study was a wake-up call for a lot of couch potatoes out there. This study in the Journal of Environmental Science and Technology showed that on average there are 44 different chemicals in the couches that were sampled in different U.S. homes. And some of these chemicals are known to be of concern. They've already been banned in babies' clothes. They're believed to be carcinogenic or cancer-causing in high doses. So it is raising questions.
Is it from sitting on the couches? Is it from breathing in the air because you have this chemical in your furniture? What exactly? How do you get exposed to it?
Well, no one has made the connection between what's in the couch and these chemicals and health, but it is known that these chemicals exist in the couch, and this study simply described the variation and the main types of chemicals in couches. And the authors of the study say, look, try to keep your couches clean, and you don't save a couch for 15 or 20 years like most people do.
But if you have a really nice couch, Doc, I think about our viewers with this. We're already, if you watch the news today, we're already telling people beware of the fiscal cliff, the country's debt, an Islamic Egypt, a nuclear Iran. And then if you want to sit on your couch this weekend, beware of that as well.
Yeah.
It's a little overwhelming. Is there anything we should do? I mean, the couch is something we have control over, we hope. Is there anything that we should do? You say keep it clean, but can we buy a couch without these chemicals in it?
Well, one of the great concerns is that 60% of the couches studied did not have a label indicating that these chemicals were there. So while I agree we've got some bigger public health threats out there in the world than our couches, it is something to ask about when you look for a couch. You know, public health studies lag behind. It takes a long time to figure out the health consequences of a lot of this stuff. It did with smoking, it does with aspirin, it does with couches.
That's not necessarily reassuring, is it? But it is what it is. So as long as we're aware, we appreciate it. Dr. Makary, nice to see you again. Thank you as always.
Good to be with you, Jenna.